Welcome to this broadcast of Role of Community Mental Health Nurses, presented by Caitlin Jacobs, Emily Holland, and Sarah Sneed. The article that we looked at was studying and looking at the differences between the roles of general practice nurses and community mental health nurses. When reviewing the literature, they learned, not surprisingly, that there is a lot of crossover between the roles and responsibilities of community mental health nurses and general practice nurses. Assessing the literature helped them to further understand that while these crossovers exist, they may not be completely beneficial to the patients. By better defining the difference between general and community mental health nurses, they believe that it would improve the ability of mental health community nurses to be able to focus on psychological assessments if their time is freed up by general assessments being performed more by general practice nurses. Some responsibilities outlined for psychologic nursing is to perform psychological assessments, to perform case management studies, to provide psychoeducational services, for example, wellness groups, lifestyle enhancement groups, dialectal. Sorry guys, I cannot read notes today. So your dialect behavior therapy, as well as to provide treatment planning and physical assessments, which those physical assessments can range on any physical assessment of the body, any system, because of there being many comorbidities in a patient who has a need for psychological nursing help, as well as to direct group, individual, and family treatment, which could include education, counseling, and psychotherapy. They found that there is a lot of blurring of practices and roles within psychological nursing realms. That often all functions, no matter the position, all nurses who work on those units, whether they're supervisors or advanced clinical experienced nurses, or just like regular base bedside nurses, often do all the same functions. And even those who are hired to work primarily as supervisors still spend up to 50 or 55% of their time at the bedside, meaning that they're not necessarily spending the bulk of their time doing what their job description was intended for them to do. What the conclusion and recommendations being from this article is that the practices and roles of nurses, particularly those who are psychological based nursing, should be better defined, and that their roles should be more specific in their job descriptions of what they actually will do rather than being too vague. This can influence how things are distributed among tasks, and by fixing and kind of correcting what some of these job descriptions are, it would help to better use nurses with advanced preparation and experience and better distribute the resources of a department rather than everyone doing a little bit of everything. This is our reference, and for your enjoyment.
Psych nurses do much more than just giving drugs.
Because that's true. Psych nurses do much more than just give drugs. They help the patients and make the world a better place. But mostly, they just do a lot of charting.